Today, I am honored to be joined by Dr. Allison Cain from the beautiful town of Georgina, Ontario. Is that right?
That's right, Ontario, just outside of Toronto.
Yeah, that for all those Americans, that means it's north of our northern border. That's what Ontario means. But Allie, you are currently sitting in your clinic / gym / education center as we speak. And what I'd love to hear is, I'd love to go into the story of how that all developed. But first off, give us a little insight to who you are and how long you've been a chiropractor, et cetera.
Thanks, Josh. Happy to be on and be talking with you. Dr. Ali here from just north of Toronto in Ontario. I know a lot about the States, but I know the States doesn't know a lot about us. So I hope I can bring some perspective and awareness, because I learn a lot from groups like yours, just in a lot of the similarities and some of the differences too. Yeah. So, I'm sitting here in Anchor Health and Fitness Center. We are a 5,500 square foot facility. 2,500 square foot of that is a gym and a spin studio. We used to, Josh, have a yoga studio as well, but with COVID constraints, we've just kept that shut down. And we also have a really large growing clinic. And the clinic has 2 chiropractors. It has 3 physiotherapists and massage therapy, naturopathy, and athletic therapy as well. So it's been a beautiful adventure, and I have loved marrying the two for so many reasons, Josh. So while I was in chiropractic school, I also owned a gym. Actually, I'll back up. Before I became a chiropractor, I started a boot camp, and it grew to be something more than I could have ever expected. But I knew intuitively that I needed more. I wanted to still stay in fitness, but also do something that could help elevate people's health and have multiple ways that I could be a part of the health industry. So I applied to the chiropractic school. There's actually just one in Canada. It's Canadian Memorial Chiropractic College. And they told me when I went for the interview, they're like, well, you won't be able to work when you're in school. And I was like, we'll see about that. So I went into school and I kept my business, and my business kept growing. So literally I would be up at 4:30, coach a boot camp, like from 5:30, 6:30 till 7, go to school all day. And I don't know about schools down in the States, but holy moly, it is intense. It's like 8 a.m. to 6 p.m. full on school when you're there. I'd get in my car, drive home, teach another boot camp class, do some homework, and go to sleep, and then do it again. And so that was great, but not super sustainable. So I had the opportunity in my second year of chiropractic school to buy into a local gym. So I became a part owner of a gym, and it was a CrossFit gym. And it was great because now I didn't have to just rely on myself to run the business. Now there was a team. Now I could be sitting in microbiology class knowing that people were getting trained by somebody I trusted. And it was wonderful. It was a really, really great experience where I also got to kind of flex my business muscles too. While I was in school, take what I was learning in class and put it right into motion. So I'd say that staying working while I was in school was one of the best education pieces I could give myself, so that once I graduated and had that license, I could hit the ground running right away. Yeah,
that's awesome. I get a lot of questions from people who are in school, young students or about to go to school, and they always say what should I do? And I always say, if I could go back in time, I'd become a personal trainer during school, because for the aspect of what you're saying of you had the business, you were very regimented and disciplined, but also you learn all this just rehab, right, in school. It's great if you know that from a book knowledge, but as you know, you try and go out and teach somebody to do a different move or get their shoulder move in a way that it hasn't, good luck with what you learned in school. You need that experience of telling somebody 8 different ways to move. Just teaching somebody something simple like a hip hinge might take 12 different versions of it. And you'll run into reasons why they can't do that. I'm scared. It hurts. My back hurts when I do it. All that stuff really would make you a better chiropractor when you came out of school. So I'm sure you had a great balance of that from just seeing human beings move the whole time you're in school.
100%. I think it was one of the best like gifts a
Hmm.
chiropractic student could give themselves. And hey, you're also making some money while you do it, as
Right.
opposed to paying for school. So it really was a nice balance. And as soon as I got into practice, I felt a lot more comfortable and confident in my communication. Doesn't matter if I graduated with the top marks. If I can't communicate to somebody,
Sure.
make them like me, know me, trust me, and believe in the treatment plan that I've laid out for them, then I don't have the opportunity
Hmm.
to actually make an impact on them. So that was really, really big for me. And
Nice.
so working throughout school was great, and it
You
allowed
completely
me.
exhausted your adrenal glands and were working full time basically, and also full time school and running like crazy, I'm sure, from school to class to all this. It gets a little better when you buy into the business because now
Mhm.
you had a team. And then, so what'd you do you graduate chiropractic school? What do you do after that?
So graduated chiropractic school. It was great. I had close to a full busy practice on day one
Wow.
because I'd already the people in the gym. I'd already been talking to them like their chiropractor, right? So
Yeah.
they knew I was in school, and they knew when they came to my class that I was looking at their movement, their CrossFit through a different lens, and so they were signed up for day one, which was incredible for them to then come in. And I felt so lucky. It was almost like a luxury to know how their bodies moved outside of the clinical space, right? So I already knew that, Joe Smith coming in couldn't really squat to depth because he had a knee injury. And now I got to actually put my hands on him, palpate, do joint range of motion, figure out how I could influence his joint health, his soft tissue, his overall range of motion. And then he got to go put that into action. And hey, I got to have my eyes on that again, or some of my coaches did. So it was this beautiful best of both world experience for the first
Sure.
couple of years
And I
of
think don't underestimate how much I'm sure that you learned as compared to the normal chiropractor coming out of school, where you got to see that feedback loop close, right? Like, hey, I think this works. I'm going to do it on Mr. Johnson here. And then I'm sure you had the experiences we all have. You do it and it's like, oh crap, that didn't really do what I thought. That didn't nearly improve him like I thought it would, and you go back to the drawing board and kind of realize this move doesn't work so well in that situation. This one does.
For sure. And if I were to think back to the rehab classes that I underwent at chiropractic school, if my 500-pound deadlift patient is coming in with knee pain, TheraBands for him probably aren't going to do the trick, right? So it did open my eyes to a whole spectrum of the individualization of somebody's treatment plan and rehabilitation. And it led to where I am now, to have access to a full gym so that we're not limited in our ability to truly get somebody moving. And we have experts in all domains that can help the hockey player, that can help the new mom, that can help the 70-year-old dealing with arthritis that just wants to get down and play with their grandkids. We have the ability to rehab them based on their needs and based on their goals as well.
That's awesome. I mean, that's true, healthcare in the fullest sense, right? Surrounding them from basic cradle to grave and specializing in every one of those different areas or different seasons of life, right? When you're a high school athlete, when you go to college, when, you're 40 and want to lose weight, when you're 70, like you said, and become a grandparent and want to still experience those memories. That's awesome. Can we talk a little bit about how the business developed as well?
Sure. So I sold my first gym, the one that I was
Okay.
working at throughout school. I moved north. I no longer wanted to be a minority owner. I was ready to grow my business.
Now, just for our American listeners, how far was it from where you went to school to like where you are now?
45 minutes.
Okay, and it's just basically from the center of the city to kind of a suburb, roughly. Is that
Yeah,
kind of the setup? Okay.
pretty much. And I was just so happened to be lucky enough that I lived that close to the school, right? So everybody in Canada pretty well applies to this school. They
Uh-huh.
take 150 a year. It's different than the US, where I think you guys have the
Trimesters. Yeah.
trimesters.
Mm-hmm.
We are a year-long program
Wow.
or a semester program, 4 years. with 2 summer breaks. And then the 4th year is a full year of a clinical residency. So that's how it's structured. That's how it's structured here. So yeah, I knew that working at a clinic and working at a gym, which is what I was doing, was great. I wanted to put them together. And so I did. And we took over this old abandoned Blockbuster. It's still nostalgic for, I actually can't believe that this space used to pay the rent just with like DVD sales and VHS
Video
sales.
rentals. Yeah.
Yeah. We kept the drop-off box just out of nostalgia, but we built a gym on one half and we built a clinic on the other half, as well as a spin studio. And when we first opened, we really marketed ourselves hard as a gym. Like we wanted to fill our space with as many happy, healthy people in this area that had been underserved, because nothing like this had ever existed in this area before. We don't even have like a Globo gym up here. So what we created was really new. It was kind of sexy, and it was flashy as well. So we actually sold out our memberships before we even opened. We put
congratulations.
We put like a 50 people can sign up at a great deal before we open. We called them our OGs, and we opened to 50 people. And so in my role as the chiropractor, I got to show up in this new town that I had just moved to, that I had just opened a business, and not only give them a great fitness experience, but also announce to them that I was the new chiropractor in town, right? Mm-hmm. And that we had physio and we had massage, and how all of these things worked together in harmony, and what the anchor definition of health is. And that the medical system, we call it OHIP here in Ontario, but the medical system, it's not healthcare. That's sick care. What you're doing when you step foot through our doors, this is healthcare. This is caring for your health, pushing the needle on your fitness, and as far away from sickness as possible.
Yeah, that's awesome. I mean, I think car commercials, I would say, reimagine the new Nissan Sentra or something. But I think reimagining healthcare and educating people as to, their participation in it is such a big deal. And a lot of times they don't kind of realize what the opportunities are. But I will tell you that, with our clinic gym hybrid and so many of my clients, like they, almost everybody reports a story of somebody walking in and saying essentially, oh my God, I've always wanted to have this, but I just didn't know it existed, and they're just blown away with the concept of, you don't have to come in just when you're broken. You can actually get better the entire time you're here.
Right. And it doesn't seem that far-fetched to you and I that live in this world, that talk to other colleagues, but it is life-changing for people when they realize that there is so much that they can do to be empowered now to ward off all of the things that they might think are inevitable in the future. And really, Josh, that's kind of where the side business that I started for new moms comes in. I just want to, because I think those listening are listening. You just packed an incredible amount of life experience into like 3 sentences there. So you graduate chiropractic college, you start a gym in your hometown, essentially where you wanted to live. And, you start that gym, you sell it out with 50 people right away. And then you're basically a brand new, peel the plastic right off your diploma and your license, right? Put it up on the wall, and bang, you're already seeing those gym members and also other community members who maybe weren't a member of your gym. Mm-hmm. And as it went on, you developed this little niche that you really enjoyed, which is the kind of the pre and postnatal. Always postnatal, or mostly postnatal? Yeah.
Okay, cool. And which I think is awesome, because I think that's one of those, one of the core tenets that I try and tell people is like, you're never going to win the war of more equipment and more space against a Globo gym. Mm-hmm. But when people go in there, most of the clients don't ever look around and feel like there's a bunch of experts in there. There are trainers guiding people through workouts, but nobody looks at them as experts in human movement and whatnot. And so when you have a woman that just delivered a baby, I don't know if there's another population that is craving more expertise and safety and the feeling of, hey, it's okay. You can't just tell me it's okay. You need to prove to me why it's okay. And I need to feel supported in that. And so I always tell people in this model, you have to sell expertise. You don't have the square footage. You don't have the equipment that the big groups like LA Fitness and Crunch and Equinox and 24-Hour Fitness, and we're never going to have that. They're dumping millions of dollars just to open the place. So slow up. What don't they have is expertise. So if you can just show your clients expertise, not all of them will. Not everybody you meet is going to join, but you don't need everybody in your community. No. It's like a country club. Like people are going there for a higher level of service, a thought that, hey, it's okay. So you pulled this niche out of postnatal women who are probably craving all the information they can about, hey, is it okay for me to do X, Y, Z? Is it safe for me to do that? And they also want to be incredibly healthy at that point for their new young baby. And so it's a perfect match in that hybrid model for that. So that's a long way of saying. So tell us about how you came upon this niche. I mean, did you have your first kid and is that what got you motivated or?
No, let me tell you what got me motivated. And you might laugh, but I really liked skipping. Like I really like in the CrossFit workouts when there was skipping involved. And I noticed that so many of the women who were members who had kids just wouldn't show up on those days, or if it was running, or if it was box jumps, or they would, kind of giggle to themselves and they would stop early because they were peeing their pants, right? Yeah. And I think we all know somebody that has had that happen, and you just laugh it off because it is so common after women have kids that they're peeing their pants. And I was like, well, I have all these protocols to heal ankle sprains, and I have all these protocols to heal low back pain and rotator cuff, but like, shouldn't we just apply those same principles to be able to heal the pelvic floor after you've given birth? Like giving birth shouldn't be a life sentence to peeing your pants forever or having debilitating low back pain, or in some cases like pelvic organ prolapse where people's insides are falling out. And it's not something that in my education that was really touched upon, but we were given the knowledge in basic tissue healing science. So I just started applying that to the pelvic floor, to exercise rehab for the core. And I started seeing all of these women get better. And a lot of them, when they started doing the core exercises I was prescribing to them, they noted that they were getting better at CrossFit, that their abs looked better, not just felt better, not just were stronger, but they looked better than before. And they were no longer peeing their pants. And so knowing all of that from working with athletes, when I did get pregnant with my first child, I was like, I'm going to write out the most solid postpartum plan so that I feel strong and healthy and empowered as soon as possible. And so I sat and I was writing it out and I was like, well, you shouldn't have to be a doctor to have access to this level of care. And so I launched here at Anchor the first postnatal rehab group-based exercise rehab program. So I emailed all of the moms in the area that I knew who had just had babies. And I said, hey, you can do exercise rehab. You can bring your baby with you. You can be led through it by an expert, by a doctor. And we can do an initial assessment first. This will be covered by your health benefits, because I don't want you not showing up because you're peeing your pants. I don't want you when you're in your 50s to tell me that you've had to have 2 prolapse surgeries.
And would you literally say in these emails and all this information, like peeing your pants, like you would say, I don't want you peeing your pants?
Yeah, because
I think a lot of people talk around these like sensitive subjects, but this happened to my wife as well. And she talked like, they don't want to beat around the bush. It's like, hey, this is the problem, address it, say it out loud, and now let's fix it,
Yeah, I mean, I don't want to beat around the bush because so many people are dealing with these and they feel embarrassed because they give birth and like the pelvic area becomes a black hole and they're embarrassed and they just deal with it. But it is so detrimental to their quality of life that I'm like, I'm a doctor. I can say, what is actually happening and people are going to start to listen. And the more honest I was about what I was seeing clinically, what I was experiencing in my own postnatal body, the more women were like, hey, that's happened to me. Oh, you mean I don't have to live with pain with intercourse? You mean I don't have to live with this excruciating pelvic pain? I thought it was just normal. My MT said it was just normal. I had kids. And because I was so vocal about it and I was telling people, you don't have to accept this. There's so much that we can do. It grew so quickly, so fast. And a lot of my colleagues started messaging me like, Allie, what are you doing? It looks different there. Group-based exercise rehab. But I was taught we can only do one-on-one. And so I really carved out this new way of delivering rehab.
Yeah. You know, it's interesting, Allie, just by chance, the last person I interviewed for the podcast, I don't know if you know Charlie Weingroff. He's a very well-versed physical therapist. And we were talking about ACL rehab. And he was saying that his whole ACL program started because he had a gym owner friend who was basically ended up doing group rehab for high school ACL post-surgical athletes. And he said, because so many of them, the problem wasn't like the tissue healing of the ligament. It was that everything surrounding there is just weak. You just need to get strong, like you need to do pull-ups because you don't have any muscle mass anywhere, let alone. So it's like, you can do this perfect graft of an ACL. Congratulations,
Yeah.
And the other thing he talked about that I think you haven't said explicitly, but I'm betting is in there, is when a young, let's say 14-year-old girl has a ACL tear, gets surgery, when she's working out next to 6 other girls who had ACL repair, and one of them's just kicking ass and, is busting out 6 pull-ups, no problem, with no help, the mental shift that goes from that, instead of the one-on-one rehab, oh, you're broken and we're going to fix you kind of mentality, is huge. It might be more important than the actual tissue changes.
100%. You hit the nail on the head there. There's this group accountability, right? There's this support system. We say community is medicine in this case, because now it's not just doctor-patient relationship. Now it's patient to patient. Now in my experience, it's mom to mom. And in the experience you just described, it's teenage girl to teenage girl. Hey, we're in this together and we can do this.
Right.
Right. So, and that's not necessarily something that's taught. And you just said, like, your previous podcast guest learned that from a high school coach.
Right.
Other people are doing this, and we know that group-based fitness works. So why not use that model for rehab if it's getting our patients that much better results?
Yeah. So just what were some of the success stories you heard in that first class? I mean, here you are, you put this together, but again, going back to that whole idea, like, it's great to have book knowledge. It's a whole other thing to apply that to people. What were some of the stories you heard in that first kind of cohort of women?
Oh, I have some amazing stories. So the first story I'll share with you that really sticks out in my mind, young mom, CrossFit athlete, went back to CrossFit at 6 weeks postpartum because she got her medical clearance, right? What happens within the first 4 weeks of CrossFit? Disc herniation, right? And at the time of the disc herniation, she didn't put it together, right? She just thought, oh, I was deadlifting too heavy, disc herniation. She came to see me clinically to help fix her back. While I was doing my assessment on her and I was palpating her abdomen, I found a 4-finger wide diastasis, a 4-finger wide separation of her abdominals. She could not contract any muscles in her core. So do you think there was any type of stability for her spine when she was deadlifting? Wow. No. So not only did she have a disc herniation, but she also had diastasis recti. So we adjusted her. And
clinically, I'm just sitting there thinking, like, you just described a nightmare scenario, because you have a patient with an active disc herniation who also has a 6-week-old kid. Yeah. I mean, that's bending over in the crib. That's leaning down to pick them up. That's bending forward to pick them up, to, change diapers. Like, everything includes flexion, and everything is below you, right? Picking up the car seat, loading the car seat. Like, you can't do activity modification as well for this person as you could if they were working in a factory, And then the second thing is, so much of rehab is, okay, well, if we're going to, if you strain your erector spinae, I'm going to try and shift as much load to your anterior core as I can, the workload. And what you're saying is, oh yeah, by the way, that was shut off. So we can't even, we don't even have a choice here. And I'm like, oh my God, this is the worst situation somebody could be in ever.
Yeah, it wasn't ideal. And for sure there was tears shed on the table, but also once we figured out that this was likely caused by a diastasis, right? We were able to do the normal disc herniation rehab, but then also start to strengthen her transverse abdominis.
Mm-hmm.
And so once we got her out of that pain state and could get her to the rehab component, we were able to heal her diastasis within a few weeks. And what do you think happened to her back? Felt good, felt strong. She returned to CrossFit a couple months later, has never had a flare up again.
That's awesome.
So, I mean, there's a lot more to the story that you could tease out to that, but long story short, my mind was just awakened in that moment to the consequences of an undiagnosed or unresolved core, in this case, a transverse abdominis, a diastasis, abdominal separation.
Are you interested in becoming a better provider for musculoskeletal conditions? Well, if you know me, you might have seen me out on the road, but I totally believe in, I adore the SFMA, the Selective Functional Movement Assessment. It is a fantastic way of assessing the movement-based dysfunctions in your patients. Now, why movement? Because movement has to do with motor control, and that's usually the first sign that pain is going to develop. And it's a better, more reliable method than assessing pain. So if you're interested in using a movement-based diagnostic system as part of your intake protocol, I would highly recommend the SFMA. Plus, they've got the best instructors. I'm one of them. So I make it fun. I'm easy to listen to. And, well, I don't know about that, but I enjoy teaching it, and it's a fantastic course. I recommend it. So check out functionalmovement.com and look for an SFMA course near you. Functionalmovement.com. Look for an SFMA Level 1 coming to your area. Hope to see you there. It's crazy because, like you said, they get their medical clearance, which I think, we can, going back to the ACL surgery pieces, they get their clearance of like, oh yeah, the wound is healed. The surgical site is healed. Go ahead.
That's okay. So anyways, now in all of my postnatal patients, we're checking for a diastasis recti, and we're setting a baseline, and then we're continuing to check in as they heal after they've had babies, because a diastasis, and I don't want to go off on a tangent here, but a diastasis is just a symptom of core dysfunction, right? Mm-hmm. That's not necessarily what we have to heal, but when there's a diastasis that persists after pregnancy, after childbirth, it means that there's a dysfunction somewhere else, and it's just a matter of time until something else goes wrong.
Well, yeah, let's, you said don't go off on a tangent here, but I'm actually interested here because what I'm hearing from you is we hear somebody says, oh, I have low back pain. And it's our job as clinicians to go, is this facet mediated? Is this disc? Is this mechanical? Is it, a pars fracture? We go down our list of all these possibilities, and some are more likely than others, and some are difficult to diagnose. But somebody, if you meet somebody out at an event and they just say I have back pain, it's like, we know that that's not the diagnosis. That's just the starting point, right? Mm-hmm. In this classification of postnatal women that you're working on, what are some of the things we may hear? And I'm doing this for my own benefit as well, but when we realize, hey, we might need to send them to a postnatal specialist or a pelvic floor specialist, what are the things we'll hear? Like you said, incontinence during workout, right? So exercise incontinence is a big one. What else?
Great question. Thanks for entertaining my tangent, because I'm really interested in equipping the clinicians that want to learn this information so that they can rule out and decide, okay, am I the right clinician for you? Or do you need to go to somebody who specializes in this, right? And we really haven't been taught the right questions with our education to be even thinking that, oh, your low back pain could be related to something pregnancy, childbirth related. So some of the things that would alert you to this being something that you would want to refer, like you said, the exercise-induced or stress-induced incontinence, and that's bladder and bowel. That's urine and fecal, because that can happen. You do want to be asking your patients, did you have a vaginal birth or did you have a C-section? Just knowing that they've given birth to their baby is not enough, because we know that there's certain things in terms of just, again, basic tissue healing science, that if somebody's given birth vaginally with no tearing versus they've had an episiotomy where there's literally been a surgical incision from vagina to anus, that your patient's probably healing a little bit differently. Or if there's been a C-section, that there's been an incision through 7 layers of tissue, and all of that is healing internally despite what it might look like on the outside. And so, oh, Josh, like I could get into this all day, but understanding their birth method would be health history question number one. If everybody listening to this right now just started asking their patients, and the male practitioners too, you're a doctor, like you can ask your patient, you can say vagina, did you give birth vaginally or via C-section? And that's going to allow you to know that, okay, if this patient's had a C-section, all of those anterior structures are now dealing with adhesions or scar tissue or whatever you want to call it. That's healing through there. So probably loading their low back in those first initial months, you need to be doing it in a smart, progressive way.
Okay.
And I'll share with you some of the literature suggests that the abdominal fascia tensile strength has only regained 50% strength at that 6-week clearance. So 6-week clearance after a C-section is not enough to go back to your Orange Theory or your spin class or whatever it might be. And Josh, we as clinicians are in a really, really beautiful and unique role where it's not that the OB or the midwife didn't do their job with their 6-week clearance. It's that is their job. Mom and baby are here. They're okay. It's our job as clinic gym specialists, as rehab specialists, as doctors to then fill that gap and strengthen their body appropriately, rehab their body appropriately, just the same way you would if somebody came in with an ankle sprain, to ensure that they feel good now, but years later. So vaginal or C-section, any exercise-induced incontinence. So are you peeing when you jump or sneeze or laugh? Do you have pain with intercourse would be my third question that you could ask, because that is going to be indicative of a pelvic floor that is tight. Now that's a bit more of a sensitive question. So you want to reframe that as how it works for you. But when a patient tells me that, yeah, I have pain with intercourse, I know that their pelvic floor is so tight that when they cough or laugh or sneeze or jump, that the pelvic floor cannot like reflexively contract to control the bladder. And that's why you see the incontinence.
So this is a muscle spasm. Basically, it's because muscles need to contract and relax. And you're saying it's only one way. It doesn't have the ability to relax enough or reflexively relax. But like that motion is what allows function to happen, right? We need every muscle in the body at some point has to contract and relax at the right moments, eccentrically, concentrically, to maintain posture, to create movement, to create digestion, whatever it is, right? Mm-hmm. All those things have to happen. And if it's in one state or another, that's problematic.
Yeah, exactly. You're exactly correct there. And the majority of people who come in with pelvic floor dysfunction or core dysfunction, or just for a wellness checkup, have a pelvic floor that is too tight, which is opposite of what most people would think. Oh, you just gave birth to a baby vaginally, it should be too loose, but that's not often the case. And can I get into a little bit more of the science behind that? Would that be?
Sure, absolutely. Okay.
So we think of our core, like you think of your anterior wall, you think of the posterior core as well, but we know that the top of the core canister could be considered your diaphragm, right?
Right.
Your pelvic floor is truly the bottom part of the core. So if it's not properly stretching and contracting, then that's core dysfunction. And typically when I see somebody who has abdominal separation, it usually means that they're not actually having that proper motion through their pelvic floor. And so Josh, your diaphragm and your pelvic floor, because it's the top and the bottom of your core, they have a synergistic relationship. So as you inhale, the diaphragm moves down atop of the pelvic organs, they press down and your pelvic floor has to lengthen to accommodate them. Okay. Then you exhale, pelvic floor contracts, everything moves back up. So you should have this relationship. I don't know how often you're.
So it's like a potato, right? You have the biggest part, like a russet potato has a big front, which is the abdominal muscle, the anterior abdominal muscles, and then the backside would be the back muscles, right? But what we're leaving out is that thing is actually got a side to it, a top to it, and a bottom to it. It's not just two flat sides, which is kind of the thing. And then It moves like a piston. It's a potato piston, Allie. Simple.
Potato piston.
Yeah.
I'll add that to my modules.
Yeah.
But so Josh, a big portion of the population, and this, if there's any like DNS practitioners out there or people who specialize in breath work, a lot of people aren't breathing properly, right? So a lot of people aren't getting that proper diaphragmatic excursion. So their pelvic floor is not getting any type of movement to it. So you have a mom that's just been pregnant for 9+ months. Their uterus grew from 2 ounces to 2 pounds. So their pelvic floor, it was doing work.
Right.
They gave birth, whether vaginally or C-section, and their body is recovering and they're navigating the stresses of motherhood. And they probably aren't breathing properly, or maybe they never were. So their pelvic floor just settles in whatever state it ends up settling in.
Yeah.
And the symptoms of that arise elsewhere: low back pain, incontinence, a diastasis recti. And so anytime.
So those are all manifestations of a core. I don't want to use the term core dysfunction. I mean core like a apple core, not core like we mean exercise core, right?
Yeah, like an inner unit core or a pelvic floor dysfunction is going to arise with other symptoms or other clues.
Do you see, just going down that path, do you see other organ issues like digestion issues or heartburn? I mean, heartburn, my wife had crazy heartburn when she was pregnant with our second kid. I'm trying to think of other manifestations you might see when that pressure in the cylinder is not correct, right? Because it's containing a bunch of stuff that there has to be space for. And if there's a lack of space, or there's, what would you call that? The tightening is not happening in the right place, right? Like we want it to happen in this potato piston.
Well, yeah.
So across it.
So like if the pelvic floor is hypertonic, if it's too tight, right? When you palpate their glutes, like the piriformis has an internal segment that is technically part of the pelvic floor. So you're going to get these like really tight glutes. So maybe that piriformis starts pressing on the sciatic nerve and you have sciatica, right? There's a whole sequelae of events that can happen because this is the center of our bodies. And to extrapolate on what you just said, like what other things would you look for? So I want you to picture this, because I think that we can all picture somebody who has this anatomical presentation. They've had kids 10 years ago and they've just never lost the body weight. I'm putting air quotations in here. They just never lost the weight. They have this distended lower abdominals and they grab it and they're like, this is my mom pooch. I can't get rid of it. I'm doing P90X and CrossFit and paleo. I can't get rid of it. And then when you look at their glutes, it's this like tucked under, they're squeezing it all the time appearance, right? Can you picture somebody like that? You probably will if you go to the grocery store. You'll see somebody like this. And so often that is the root cause is pelvic floor dysfunction, because the pelvic floor is no longer contributing to postural or core strength in the way that it needs to be. The glutes are now acting as destabilizer muscles. So they're squeezing all the time. And I felt this when I was pregnant. Holy moly, my bum muscles were squeezing all the time when I was treating patients. And so they just stay tight all the time. And it literally changes the anatomy of your pelvis, and your lower abdominals become distended. And so it's not necessarily excess fat, that's the mom pooch. It's like your literal anatomy and physiology has changed because your pelvic floor cannot properly lengthen and contract, right? Yeah. And I mean, for the purposes of our podcast, I am oversimplifying this, but at the end of the day, these are things that you're going to see. And as a clinician, we can't be ruling out the pelvic floor just because we're not necessarily comfortable with it. It's our job to, recognize, rule in, rule out, refer if needed, or do what you can do. Adjusting those patients is going to help, but then getting them to do some pelvic floor physiotherapy, or getting them to do some GrowCo postnatal rehab, or whatever it might be.
So, I mean, we're kind of getting close on time here, and I want to respect the fact that you got to get back to all these postnatal women and get back to the gym. But let's talk about this. So we have this, obviously you have expertise in this area of postnatal women, right? And you have this clinic and gym. How has that expertise translated into gym memberships for you? Because I'm sure there's a lot of people that are like, hey, I maybe they're not interested in pelvic floor. That's totally cool. But they're like, I really specialize in cyclists with knee pain. Awesome. Just what it sounds like you did is you offered educational based marketing, right? Come in, we'll talk about your, as you said, the exercise induced incontinence. That brings them in, and then you give them this presentation. They go, oh, this this woman gets it. I mean,
Mhm.
finally somebody's singing my song, right?
Yep. So how it works in the gym is, number one, as the owner of this gym, I don't want anybody in my space getting injured, right? The goal is healthcare. I want to make sure everybody is thriving, is having a good time, is feeling
Yep.
healthy. And the thing that most new moms are missing is guidance. So like any gym, women get pregnant and they still come and then they give birth. And a lot of times you never see them again because they just don't know what to do.
Right.
And
It's
so
that expertise, man. I hope
it
everybody hears
is,
this from Allie.
it
Like,
is.
everybody rolls their eyes when I say that. I'm like, that is all we have. I mean, you could have a gym with no equipment, just open space and old carpet, and you could thrive if you just showed people you know what the hell you're doing.
Know what the hell I'm doing and care about them and give them the guidance so that they feel empowered to make the choices that they want to choose. Right. So we have tons of women who come here because they know that there's a female owner who gets it, who understands the unique demands of pregnancy and postpartum. And they can call me up when, they give birth and say, okay, what do I do now? And I say, all right, let's take a look at you. This is the plan. And when they do come back on that first day, I'm either there or I've empowered my coaches to say, hey, so-and-so, welcome back. We're so happy you're here. You just gave birth 6 months ago. So here's where we want you to start. And if you feel this, this, and this, some of the things that we chatted about earlier, if you feel any type of incontinence or low back pain or any type of heaviness in the pelvic floor, that's an indication to let me know we should swap out that movement. Right? So they feel completely taken care of and they know that they're not setting themselves up for, I don't want to use the word failure, but for any of those common ailments that I contend
that stopping a workout is not because you're just weak. That's not why we're stopping. We're stopping because it now doesn't fit this model of healthcare. And that's okay because, I mean, CrossFit is inherently competitive. And that's one of the great things about it, right? I want to, since you are a blonde woman who looks like she's in shape, I will tell you the story. Like, the most motivated I've ever been in a CrossFit workout was deadlifts and sprints. And I was lining up on the line to take off on sprints. It's like 5 rounds of, I can't remember, 200-meter sprint and then 12 deadlifts or something. And the woman to my left, this in shape, attractive blonde woman, pulls out lip gloss, puts it on right before the workout. And I, in that moment, decided I needed to kick her ass as hard as I could because it violated everything about a workout to me. Then the gun goes off or the whistle blows and essentially she turns into a rabbit and smokes my ass. But anyways, but that workout was incredibly motivating trying to catch up to her the whole time. Right. So anyways, it's just at that point, if I had stopped 4 rounds in, there's this inherent thought like, oh, that's because I'm a sissy or, the weight's too heavy or something. And what you're saying is if I stopped and I walk up to you and I go, Allie, I just did that 4th set of deadlifts and something doesn't feel right on my back. Can you talk to me about it? That dialogue now opens up the world. And we're not going to get people who push through that 4th and 5th round, maybe inappropriately, and end up with a disc herniation or a strained muscle or whatever.
Yeah.
Right?
Yeah. And I've
a different
set them up for success because we talked about their postpartum plan while they've been pregnant, whether it's in the gym, in the clinic, or both. I've said to them, generally at about 3 months postpartum, you can get back to impact exercise slowly. And these are the different things that we'll swap out. So they already know to expect it. They already know that I'm looking at them through a different lens. So they don't feel embarrassed or less than when they're swapping out ab mat sit-ups for dead bugs. They know that, hey, actually that's going to get me, that's going to rehab my core faster without doing any damage to my pelvic floor. Why wouldn't they opt for it? And we've created this culture now around that. I mean, we have men in the gym too. There's all sorts of different dynamics here, but we've created this culture for women who've given birth that's very supportive and inclusive rather than, oh, you're less than. No, you're rebuilding.
Yeah. I hope people are listening to this with not just the blinders on of postpartum women, but any niche, golfers who often injure their low backs, want to get back to golf, but sometimes that is a long journey. If you're just the expert that teaches them, hey, today we're going to do dead bugs because it's going to lead to longer drives in the future. That stance and that approach is so much different than every other gym in the US. So you mentioned it's not just these women in your gym that that's who you bring to the gym, I would guess. Like that's mostly who you bring, but it's a general pop kind of active adult, everybody in the neighborhood kind of thing. Okay.
Yeah. Yeah.
And how has the gym worked to build your clinic? Because a lot of folks listening to this want to have the clinic in the gym, and most of them are starting from a full clinic and bleeding into the gym. But you, before we recorded, you said that there's another effect you hope people recognize about the gym being busy on its own.
Yeah. So one of the neatest things that I didn't foresee when we first opened was the fact that we're a clinic, but we also have high foot traffic because people are coming in and out of the gym in the spin class. So they'd swing by the front desk and talk to our receptionist and be like, hey, does Dr. Ali have an appointment today at all? I just, I'm feeling like I need an adjustment. And they could book them in, right? So we're not just a destination, we're a place that people are already. Or if there's a last minute massage opening, we'll open the gym door and we'll say, hey, Fran has massage opening at 4. Does anybody want it? And honestly, more times than not, people are like, yeah, put me down. So it's built this clinic so much quicker in an organic way than if we had just opened a clinic, put up a sign and said, come see us. And we had that much more volume of people or eyes on us because we were a gym. And inherently, Josh, people, I say this all the time, like, you got to give people what they want so we can give them what they need. They might think they need weight loss, so they show up to the gym, but what they actually need is nutrition help and conditioning and a proper like stretch and strengthen and physio and chiro program. And so you give them what they want, they come to the gym, they have an awesome workout, a great experience, and then we get the opportunity to give them our expertise, to give them the guidance and paint this picture of where they could be if they take steps A, B, and C. And I believe, even as a chiropractor now, right, coaching a class it's not as lucrative, right, as being a clinician, but it's an ability to like infuse my knowledge to a mass amount of people who are already receptive to it. Like we've pre-qualified these people to be listening to what we have to say. And so I get to say what I want to say. And almost every time somebody's interested in what I have to say, or they want to see somebody in the clinic because they understand it from this next level.
Yeah, I love it, man.
Yeah.
This has been awesome in ways I didn't even know it was going to go. So we had talked maybe last week or over the weekend, and you actually put on some webinars and live workshops for clinicians who kind of want to get into that postpartum world and understand it more, right?
Yeah, that. And so I think what you're talking about is like the get back to running after baby. I think that every clinician should have that information so that they can decide whether they are the person that should be treating that person, right? So definitely I have seminars and things that I train. Where
can people find those?
growcorehab.com, on Instagram.
Grow like GROW co, right? All right. So growcorehab.com.
Yeah. Okay. Yeah. And then I'm on Instagram. We have a ton of free resources. Instagram at growco.rehab. Browse around, reach out. I'm always willing to chat because I know that this is a huge area that was missed out on in a lot of our education, and we're doing a disservice by ignoring it to women. So any opportunity I can take to support clinicians, to empower us to then make a bigger impact on women, it fulfills my mission, which is to raise the standard of care for postnatal women around the world.
Yeah, I think you have touched on the model that I wish so many people would grab onto, which is, in marketing, they always say like, find the niche, and it's so much, everything becomes easier if you know who you're going after. For example, like you don't need to approach women over the age of 60 because you're going after women who are in that age group of having being pregnant and delivering, right? And it's so much easier when you do that. And if you are, I have a friend who only works with bodybuilding athletes. Like that's what he wants to work on. And, when they pose, like what most people don't understand and most clinicians don't understand about rehabbing them is they have to create the most amount of tension in a joint. So you can't say like, oh yeah, just, do something else. No, they have to get the full flex of their lat. And if you got back pain and you flex your lat fully, that hurts.
Yeah.
So he just understands that more than anybody. But it's so easy because where do those people hang out? They hang out at gyms and supplement shops. That's where you need to focus on them, right? And I want to go after golfers. Where do they hang out? Golf courses, right? But golf courses would be a horrible place to meet my friends bodybuilders. And they might not be that great of a place to go for your women who are postpartum. And so if we just look at those things and apply our expertise and dive down that rabbit hole of how to help these people, it becomes so easy to build the gym, to build the clinic, to build everything off of that. Yeah. So Allie, I certainly appreciate your time today, because I think this is just so many gold nuggets within this interview. And I hope people do reach out to you, because I think you've set the pace for how the model should go.
Thanks, Josh. I love it. I show up to work every day. I love who I work with. Everything is just going so much better than I ever could have imagined. I'm 6 years into practice at this point, and I've already claimed my niche at 3 years into practice. And I know there's new grads listening to this. They might be like, oh, I just, want a warm body on my table. And certainly that's fine. Like, you'll learn off of that. But when you start to tease out what lights you up, you'll give that much better care, and those people will feel that much cared for, word of mouth, and your clinic will be bursting at the seams in no time.
Yeah, I think those are words of wisdom for everybody listening. Well, once again, Dr. Allison Cain from up north in Ontario, Canada. I think you're setting the bar. And what was the name of your gym again? It's Anchor Fitness?
It's Anchor Health and Fitness Center.
Awesome. Well, I hope people can look it up online and check it out. Allie, this has been a slice of heaven. I certainly appreciate your time today. And everyone out there, I'm going to say this line that I say at the end of every podcast, but I hope you see what it's like when you hear Allie talking about it. Go out there, maximize your license, and live the life you dream of. Allie, thanks so much.
Thank you. Thanks so much.
Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.